a member state of the World Health Organization. Thank you.
Thank you very much. We will now go to Brazil again. We have Lara Pinheiro from Globo. Lara?
Hello, good afternoon. Thank you for taking my question. I would like to know how useful is temperature screening in public places to look for COVID patients, since some studies have already shown that fever is not always a symptom of the infection. Thank you.
So thank you for your question. I will begin. You've almost answered your question with your question, in the sense that many people ultimately will have a fever, but not all people present with a fever. There are many ways in which people can be screened. Temperature screening is one, but there are a package of measures that need to be put in place to identify cases. And so, as we have pointed out, it is very important that there are systems in place that cases who are suspect cases, if you're feeling unwell, you stay home and you contact your medical provider. Suspect cases are tested so we know if they are indeed a case or not. And I will again highlight influenza here. If you have respiratory symptoms or you're feeling unwell, not only looking for COVID-19, but also looking for influenza, especially in the Southern Hemisphere as the influenza season is taking off. It's important to know what people are infected with, and to follow all of the other measures that are in place. So as you mentioned, not all people will develop fever, and not all people will present with fever. Thanks.
Thank you, Dr. Van Kerkhove. We will now go to Emma Farge from Reuters. Emma?
Good afternoon. Thanks for taking my question.